Well, thank you for the opportunity to speak to you this evening. I just want to say a few other things about the Mann Center as an available resource for you. We do have all kinds of groups that are open to any cancer patient. They don't have to be treated at UCLA. For individual support, you would need to be treated by a UCLA doctor, but we have meditation groups, mindfulness meditation groups, guided imagery. We have a spiritual reflection group. We also, as Ashara said, have 20 years worth of lectures on our website, videos. There's a lot of written information. So it's a great resource to have even if you can't get to UCLA and if you're not a UCLA patient. In the population, the patient population that I serve at UCLA, I would say that the lion's share of folks identify as spiritual, not religious, which is pretty consistent with national polling about how Americans tend to identify themselves spiritually. It's an ambiguous term, so I will often ask a patient, what do you mean by that? And they'll ask me, what do you mean by spiritual? And for myself, I'd have to go back to the Latin root of the word, spiritus, which simply means breath. So what is it that breathes life into your life? What is it that gives it meaning? What is it that makes you get up and want to face another day? For some folks, that might be a deep connection to a religious faith or community or practice or ritual. For some, it might mean a more personal relationship with God, the divine, nature. For some, it might mean their family. It might mean their dog. It might mean their job. It might mean a great round of golf. Or it might mean surfing the perfect wave. For some, it might mean the place where they feel that connection to a larger truth or reality. It might mean the beach. It might mean the desert, the mountains, or the Thanksgiving dinner table. Whatever it is, as anyone in this room can attest, a diagnosis of cancer can really mess with all of that. Because what used to feel true yesterday and feel meaningful today doesn't feel so meaningful, or I don't have access to it in quite the same way. So I might have to find a new sense of meaning, or at least a new way to access it. Permit me to digress for a moment. In September of 1985, my husband and I took a trip to France, and we spent an entire day driving through Normandy, touring the D-Day beaches, which was territory my own father had bombed some 40 years earlier from his B-17, paving the way for the D-Day invasions to follow. At the end of the day, we made our way to Mont Saint-Michel off the north coast of Brittany, and we arrived just as the sun is setting behind the silhouetted spire of the mount that's rising up from this vast coastal plain. I was transfixed by the mystical beauty of this improbable medieval gem and by these swirling tides that looked like the gods were just pouring water over the earth from some unseen pitcher. We bedded down for the night at Mare Poulard. We made a reservation for an English-speaking tour of the Abbey at the very pinnacle of the mount for the next morning. The tour guide spoke with such a thick French accent that I could only understand maybe every third word she was saying. But she did use an expression I deciphered quite readily, the Gothic heart. Actually, it sounded more like the Gothic heart. And the first time she said it, I turned around and poked Scott in sheer delight. Ooh, the Gothic heart, I love that. What do you suppose that's about? I think I have one. I've always felt this affinity for the Middle Ages and for monastic life in particular. She used the expression several more times, but she never came back around to any explanation that I could understand anyway. Till about 45 minutes into the tour, I realized she wasn't saying Gothic heart at all. She was saying Gothic art. Those of you who are old enough to remember Gilda Radner on Saturday Night Live, I had my own little Emily Latella moment. Never mind. Still, I was crestfallen. I loved the idea of the Gothic heart, so much so that it still sticks with me some 30 years later, but all in my mind. My point being, meaning-making is a creative endeavor. It is individual. It is ever-evolving. We do, in some ways, make meaning collectively, as a group, as a society, and sometimes those meanings can seem solid and fixed, maybe even universal. A shiny new BMW means financial wealth. Financial wealth means success at life. A long marriage means you must be happy. As the wave of life washes over us, we come to understand how untrue such assumptions might be, and that everything isn't quite as it appears on the surface. But whatever meaning we attach ourselves to, whether it's the communal meaning or something that we have created ourselves, it is an individual journey. There is a whole world of communal meaning attached to cancer. Most of it is couched in the terms of fight and struggle and battle. The language around it is so pervasive we may not even hear it anymore, but it's all over the place. Oh, she's battling breast cancer. We'll read an obituary, he lost his valiant battle with lung cancer after a brave fight. Does it really need to be seen through that lens? Many of the patients that I see reject such imagery of war and battle. They choose to reject that imagery. Clara was in her 20s undergoing a stem cell transplant for leukemia with her mother by her side every step of the way. They were devout evangelical Christians. Now, I've supported hundreds, if not thousands, of Christians over the years, and I'm used to hearing the different flavors of how someone interprets their crisis through the prism of their spirituality. But Clara and her mother had a unique perspective. Her mother said to me, "Michael, this cancer is a part of my daughter, and therefore it's a part of God. And so I have to love it as I love my daughter and as I love God, and I believe through that love she will be healed." Claudia was in her mid-50s, breast cancer patient, very reflective, highly intelligent woman. She shared with me, "Michael, I can't afford to be at war with my own body anymore. What if my body's doing the best that it can? I want to love my body. I want to love it so well that that cancer just releases and goes back to wherever it came from." In a similar kind of way, Rhonda saw her cancer as a dance with a tiger. She had the most beautiful metaphor of waltzing that tiger back into its cage. Still, some folks really resonate with that language of war and battle. Carlos, he was in his 20s dealing with testicular cancer, and he loved to use creative imagery, and he saw his cancer as this violent video game, a war to be won. The thing about that language of war and struggle and battle is that it promotes a dualistic, either-or, black and white kind of thinking with language like win and lose, success and failure. We had a discussion about this very topic in my own Circle of Reflection group that I facilitate at the Mann Center every month. What does success with cancer look like? Well, the obvious answer is cure, right? But if I've supposedly been cured of cancer, but I'm living in terror of its return, or if I'm grieving so terribly what it's cost me, what I've lost along the way, who won the war? For some folks in the group, success meant getting my old life back, whatever that means to them. For some, it meant living long enough to see a beloved child or grandchild graduate from high school or college or get married. For some, it meant finish the book I've been writing, the project I've been working on. For some, it meant growing spiritually into a deep place of peace with whatever is. For some, it meant living long enough to witness a miracle from the Lord so I can give testimony and bring other folks to the Lord. But the thing is, success and failure, sometimes it's hard to tell which is which. What if cancer just is, like a wave in the ocean moving toward shore? A wave that has the power to cause harm, to be sure, but surfers pray for such waves, for the sublime thrills of the peaks and valleys of the ride, even the risk of wiping out altogether. And from what I've observed of those riding the cancer wave, there is the opportunity, maybe even the invitation, for profound spiritual growth. We might discover a whole new understanding of who we are, what we're made of, what we're connected to. We might discover love, joy in the unlikeliest of places. We might discover new definitions for God, higher power, healing, cure, success, failure. We might discover what it means to be a human being, to love and be loved. Or we might not. But the wave is real, and it will take us on a ride whether we would go along willingly or not. And before you say, "Oh, come on, nobody goes along willingly on this ride," I did have a patient, Dinesh, who was Indian, born in India, steeped in that culture and religion. And when he was diagnosed with stomach cancer, he most sincerely said, "Okay, now I get to experience what this is like." We have a choice to make of how we're going to relate to that wave. But while that wave is real, it's also an ever-shifting, ever-changing environment. And our ability to ride that wave has to be flexible enough to change and shift with the movement. Like taking any trip at all. It's really a skilled traveler who can let go of yesterday's expectations and hopes and goals and accept today's realities, expectations and hopes. Maybe this trip started off to be our ideal honeymoon, but now with the advent of this hurricane in the forecast, it's about getting home safe and sound. Still, it's a skill how we're going to come to terms with that wave with a steep learning curve, because that wave can rock us to our very soul of everything we've held to be true and dear and sacred. What I have found is that how we come to terms with riding that wave is ultimately a matter of faith. Now, it might be a faith that's articulated in completely religious terms, or a faith that's articulated completely in secular terms, but it's faith nevertheless. In religious terms, that faith might be God is going to give me a miracle, or that it's deepening my faith through suffering. In secular terms, that faith might be in my doctor, or this drug trial, or vitamin D, or positive affirmations, or organic vegetables. Either way, it's a matter of faith. One article of faith that seems to transcend the religious or secular spectrum is the idea that everything happens for a reason. I hear that from folks all over the belief map. Now, that reason might be articulated in religious terms, in spiritual terms, or secular terms, but it's the same theme. Everything happens for a reason, and I'll take my peace there. In religious terms, that reason might be the Lord's testing my faith, or bringing me closer to Him through my suffering, or it's a punishment because of some bad thing I did. In more spiritual, less religious terms, that reason might be it's a wake-up call. It's a reminder to put my attention on what really matters in life and what's important. In secular terms, that reason might be it's because I've been angry all my life. It's because I didn't take care of myself. It's because I didn't exercise. For some, it's so fundamental, this belief that there's a reason, it just gets expressed as, I just believe there's a reason. I don't think we can know what it is. I hope one day to find out. Any one of those statements has the power to bring us comfort and peace. It also, anyone, has the power to intensify our suffering. Because what if it's because of something I did or didn't do? It's because of something I prayed or didn't pray. It's because of something I believed or didn't believe. I must be some kind of idiot to have needed this particular lesson. Couldn't I bought the Cliff Notes on this one? Where that faith meets the wave does seem to tell the tale. And it can often mean a spiritual crisis. We go through life sometimes so certain of what we believe and hold to be true, we get a diagnosis of cancer, suddenly all bets are off. I don't know what's true anymore. So I suppose a good place to start on this wave is, what's my relationship to spiritual crisis? Can it be okay for that first wave, or 2, or 10, to wash over me, churn me around, bounce me off the bottom of the ocean, leaving me with a mouthful of sand and water, spitting and sputtering? Can I offer myself grace, allowance to just be there, splashing around in the water, gasping for air, trying to get my bearings in this new environment, deciding where it is now I'm going to put my faith? I meet a lot of folks on their first visit, and they'll say, "Oh, Michael, I have very strong faith. I'm just fine. Thanks for coming." And I know they think they're being terribly clear in saying such a thing, and I don't have a clue what they mean. Faith in what? Faith in God, faith in prayer, faith in Jesus, faith in themselves, faith in their doctors. And if it is a faith in God, what does that faith tell them? That they're going to be healed, or that they're not alone, or that God doesn't give us any more than we can handle, or it's thy will be done, not my will be done? Any one of those statements of faith is going to ride the wave in a different way. And what if it's just not up to the journey? Ruth was newly diagnosed with breast cancer, and I only met her once, her first day of chemotherapy in the infusion clinic. When I met her, she's a devout evangelical Christian, and she said, "Michael, the Lord isn't testing me with this cancer. I'm testing the Lord. I'm going to go through chemotherapy, and I'm not going to lose my hair. Too many people are counting on me. Too many people depend upon me. I can't afford for anybody to know I'm sick, so I'm just not going to lose my hair." Well, this raised a bit of a red flag for me. What would happen when she did lose her hair? Would that mean a spiritual crisis? I gently tried to tease apart her theology to see if there was a bedrock of belief there that could include the circumstance of her losing her hair. Sadly, she wasn't open to that discussion at all. Now, I don't know if she did lose her hair, and if she did, if it were a spiritual crisis. But if it had been, I would say it's no different than anybody else putting all of their faith in this drug trial, in vitamin D, in positive affirmations, in yoga, in letting go of all of my anger, and discovering it had no effect on the cancer. I don't know what's true anymore. I don't know where to put my faith. Karen was newly diagnosed with lymphoma, and when I met her, she said, I don't know what I did to deserve lymphoma. Karen, what could you have possibly done to deserve lymphoma? I don't know, she said, but it must be something. And it was as if that statement brought her a backwards kind of comfort. It still promoted the idea that she was in charge. She was in control. She screwed up, that's why she has cancer, but hey, I'm still in charge. To consider the possibility that the cancer just happened, that she was powerless over it, was simply too much to take in, too much to digest. And I would suggest that powerlessness, coming face to face with that, is the fundamental spiritual challenge that seems to hit everybody going through cancer, regardless of where they land on the belief map. Ask anybody who's just been diagnosed with lung cancer or has a loved one diagnosed with lung cancer. What's the first question anybody asks? Were you a smoker? Did she smoke? I would suggest that it is our fear of powerlessness that would inspire such a grotesquely insensitive question. The thinking being, oh, she smoked? Whew, I don't smoke, therefore I'm safe. I won't get cancer. Too bad for her. What happens when we discover that we can't control the wave? When maybe a faith that's kept us afloat our whole lives meets its limitation? What happens when our certainty meets doubt? At that particular intersection, some folks deny God, they get angry. They get angry at God, they get angry at their doctor, they get angry at their diagnosis, they get angry at themselves. For what? For not living a healthier lifestyle, for not going to the doctor sooner, for not eating a healthier diet. One that I heard not too long ago that absolutely broke my heart. Michael, I don't think I've lived a good enough life to deserve a miracle, to get God's attention. Carolyn had no trouble at all articulating her spiritual crisis. If anything, she was so happy to have somebody just listen. 6 months earlier, her 39-year-old daughter had been killed in a car accident, leaving behind her 2 teenage grandchildren to be raised by her former son-in-law, who was an active substance abuser. Now she finds out her 34-year-old son, her only other child, is diagnosed with metastatic colon cancer. It was just too much for her to take in. And Michael, it's not like I don't understand loss and death and everything. My mother died when I was 7, my brother when I was 12. I've worked in nursing homes. I get it about death, but this, I just can't handle it. She was someone who had taken a lot of comfort and peace in her prayer life, but shared with me that, Michael, I haven't been able to pray in months, don't even want to. And you know what else? When people tell me they'll pray for me, part of me wants to say, don't bother. Isn't that terrible? We looked at what did she really believe was true now about God, not what she had been taught or what she should think, but what seemed true now. What is really the nature of prayer? And did her standoff with God mean she wasn't in relationship to God? I would suggest just the opposite. We tend to only fight with those we really love and care about. Otherwise, we would be indifferent. I imagine most of us here have had that experience of fighting with someone we love so passionately, we get so angry, say, you know what, I'm so angry with you, I just can't be in the same room with you anymore, I gotta go take a walk around the block. Could her standoff with God be a kind of walk around the block? Could it even be a kind of prayer? Yes, sometimes those waves hold us underwater and leave us spitting and sputtering and gasping for air, but I find generally we do float. There is oxygen and we do get our bearings. Rita was so desperate to understand the reason why she had cancer. She was so angry. I wish I could blame it on somebody. I wish I could blame it on my husband. That's what I really wish. And I'm so angry. I'm angry at the doctor. I'm angry at myself for not going to the doctor sooner. I'm angry at myself for being angry. I've been angry all my life. I'm sure that's why I have breast cancer. I just want to know why. It's a pretty common feeling I find among patients, maybe for some of you here. I just want to know why. I want this tidy answer. But if I could hand out an envelope tonight, a sealed envelope with your name on it, and a little card inside that said, "This is why you have cancer," would you open the envelope? And if you did, do you suppose you'd suffer less or suffer more? To find out it's just your genetic bad luck, or it's because you didn't take care of yourself, it's because you carried too much weight, it's because you ate too many Big Macs when you were in high school, or it's because you didn't do very nice things earlier in your life. It's karma catching up with you. What if it's nobody's fault? What if the cancer wave just is impersonal? Nobody to blame. From what I observe, coming to terms with that powerlessness can be the window to profound peace of mind and heart. Yes, that powerlessness can be the source at first of our greatest spiritual distress, but it can also be the doorway to awakening and maybe even healing. Another word for powerlessness might be vulnerability. So much in our culture would tell us to avoid vulnerability at all costs. You better wear your seatbelt, get some insurance, lock your door, get an alarm system, wear a helmet, don't drive in that part of town at night, don't ask for help from anybody, and don't let anybody see you cry. From what I've observed, though, magic in life gets revealed when we move in the opposite direction, toward our vulnerability, toward our powerlessness. And if cancer is anything at all, it is a doorway into the land of the vulnerable on so many levels and in so many dimensions. Still, I would say it's a skill, it's a learned skill, and it's a choice how we are going to come to terms with powerlessness, with vulnerability. We might meet it with anger and denial, kicking and screaming every step of the way, or we might meet it with more fascination than fear. Either way, we're going to get profound growth because that cancer wave holds up a uniquely powerful mirror to everything we've held to be true and dear and sacred our whole lives. But still, it can be an incremental movement from maybe anger and denial to some kind of peace and maybe acceptance. One of the oncologists asked me to come support Victor in one of the exam rooms, who was about to find out that the pain in his back was not the pulled muscle he had hoped, but it was indeed a metastatic sarcoma. It was nearly impossible for Victor to take in this information. He had seen himself as a pristinely healthy young man, a yoga teacher, a meditator, a vegan, an exercise nut. This just didn't compute. It took a good long while to tease apart and unpack everything he heard in that doctor's office and what was really true and what wasn't. Speaking of incremental movement, he started from a place of, I'm not doing chemotherapy. That's poison, that's toxic. Why would I put that in my body? My body is just going to heal itself, and if it doesn't, maybe it's just my time to go. And he moved over time to that position where he was willing to go through chemotherapy, and he made a choice. I'm not going to call it poison or toxic anymore. I'm going to call it my golden infusions. And he's undergoing it, he's doing great, his tumors have shrunk, but it's been a growth process, an incremental process. Like any growth process, I find there can be opportunities and there can be obstacles. And on the cancer wave, I find both are formidable. And most of the obstacles I find in coming to peace with that powerlessness have to do with themes of attachment. Attachment to identities, attachment to beliefs, attachment to outcomes, maybe even attachment to the old meanings we have made of life. I've worked in many different settings as a chaplain over the last 15 years or so. I've worked in oncology, obviously, for a long while. I worked in the psychiatric hospital. I've worked in liver transplants, hospice, palliative care. Each setting in which I work seems to have its own unique constellation of spiritual challenges that kind of come up to the surface. In liver transplants, for instance, many people need livers because of past self-destructive behaviors. drug and alcohol abuse. So there can be a lot of shame and disgrace. You mean I really have to wait and pray that somebody dies in order for me to get a second chance of life? And do I really deserve that? On the cancer journey, I find often one's whole identity can kind of deconstruct right before my eyes. Everything that I had kind of grabbed onto to say, this is who I am, it just kind of disappeared. I had a patient once who was a brilliant engineering professor who got brain cancer. And he said, Michael, I used to be smart. That's who I was. I'm not smart anymore. Does he cease to exist? It might be something for us to think about now. If anybody's going to know you at all, what are these 3 or 5 things they got to know about you to know your essential self? Maybe I'm a mother, a grandmother, I'm a talented artist, I'm an athlete, I'm known for my beautiful head of hair. That would be me. Imagine none of that is true anymore, or not in the same way. Who would you even be then? Is there even an essential you who is deeper than all those labels to which we would have attached ourselves? What's more, is he or she worthy of love? Is he or she capable of giving love? As painful as those questions might be to hold, I think they're worth holding. Because as one who's watched thousands of patients walk this journey, whom I would just as soon call my teachers, what's on the other side of those questions is profound indeed. It's beyond words, even though no one signed up for that particular journey. Now, while that identity and that journey towards spiritual essence might be a blessing in the end, what can hinder that process is this attachment to this old identity. One of the oncologists asked me to go see Vicky. She was very concerned about her level of distress, and she thought she might need a psychiatric evaluation. In any event, Michael, she's in the infusion clinic now, and she's sobbing. Will you go see her? Well, Vicky has been dealing with a particularly rare kind of cancer for over 15 years. And in those 15 years, she's been on maybe a dozen different drug protocols. Each one's worked for a time, maybe a year or two, and then it stopped working. Today was day 1 for yet another drug protocol, and she was just cooked, just done. But to hear her tell it, oh, Michael, through her tears, I'm really so lucky. I am so blessed. At least my cancer's treatable. And look, I have this wonderful family. I have a husband and kids and grandkids, and I have a wonderful church community and this deep faith. Really, I'm so blessed. And it was like the more she talked, the tighter the rope got around her neck, because she just couldn't reconcile these all too human feelings of despair, weariness, frustration, disappointment with her essential identity as she saw it as Little Miss Sunshine. I don't think she was so distressed about starting a new drug protocol as much as she was moralizing with herself about all of these human feelings. I mean, Michael, look around here. So many others have it so much worse off. Why am I such a crybaby? Does that sound familiar to anybody here? And look at those themes she raises there, not just her attachment to her identity, but themes of grace and compassion. Grace to be just a human being, to be who she is. It was as if she had decided to compose a symphony called Vicky, but decided we're only going to use these 5 notes. We're only going to use joy, happiness, forgiveness, and gratitude. We are not going to use any deep, dark notes of regret, despair, anger, frustration, revenge. The thing is, it takes all 88 keys on a piano to write a full-bodied symphony. It takes all those deep, dark notes, all the sweet high notes. A few deep, dark notes in the Symphony of Vicky does not eradicate her essential sunshiny spirit. It doesn't make her less of who she is. It makes her more. And then in comparing her suffering to others, why am I such a crybaby, reflects this coping strategy that I think we all use, the it could be worse strategy, as a way of snapping ourselves back into this attitude of gratitude. That strategy we can use it to beat ourselves up. Who am I to cry like that? Look, they have so much worse. I hear patients all the time say, I threw myself quite a pity party yesterday, but that's it, I'm done. And it breaks my heart, really, to hear somebody talk about themselves with so little compassion. Every religious tradition on the planet upholds compassion as a revered virtue, and yet when we feel compassion for ourselves, we're going to moralize about that, judge it, self-pity. We don't want any of that. As Vicky could come to embrace this more fully dimensional version of herself, as she could cut herself a little slack and offer herself the grace to say, yeah, I still have cancer and this sucks. She was free then to move on her journey. She's been on that particular drug protocol for now close to 6 years and is doing great. Yes, sometimes those waves will carry us underwater, maybe hold us underwater, carry us out to sea. We get caught like in a riptide. I grew up in Long Beach, and every spring the lifeguards would come to give us a water safety assembly before summer came. And they told us what to do if we got caught in a riptide. Don't try to swim against it. You will lose. You may drown. Let it carry you out. And when you can, swim out of it, parallel to the shore. Get your bearings, rest up, and then swim back to shore when you can. Struggle, I find, guarantees we're going to stay in struggle. It's like those little Chinese finger puzzles we used to get at carnivals as kids. Remember those, the bamboo, and you stick your fingers in, Mom, I can't get my fingers out. And then you just kind of take a breath and relax. But these thoughts might overtake us. This can't be. It's a sin to despair. I can't be angry with God, but I'm such a good person. This can't be happening. What if we just let those feelings carry us out for a little bit when we can? We swim outside of them. We get our bearings, and we swim back to shore. Aside from that attachment to identity, before cancer, sometimes we get tripped up inadvertently to our identity as a cancer patient. I can't tell you how many times I'll introduce myself to a patient, and when I ask them about their lives outside of cancer, I swear you can see the whole shape of their face change. As soon as they start to talk about their kids or their dog or their job or their passion for art or whatever it is, it's like for a moment they forgot that they were more than a cancer patient, that they were connected to more than an IV drip or a telephone to an insurance company or to a scheduler to try to straighten out my chemo schedule. Kyle presented an interesting twist on this identity as cancer patient. He was given the all clear by his doctor. You're cured. Go live your life. The news everybody wants to hear, right? And yet he was immobilized, paralyzed. He couldn't go forward. And it's not like he didn't have things to put a demand on his time. He had a business to take care of. He had a wife to take care of, bills to pay. But I can't move. I can't do anything. And Michael, I'm the one who beat the odds. I'm the one who succeeded. My church had me give a talk about success and cancer, and look at me. I can't move. It was as if he had taken on this identity of cancer patient as superhero, like the latter-day version of Lance Armstrong before the fall from grace. And we looked at what it might mean to take off that mask and put it down, come out from behind it. Allow people to see your humility and your humanity. And that even though I beat the odds and I got cured, cancer still kicked my ass. What kind of an inspirational speech might that be? To own that humanity, that humility, and to offer others the grace to be themselves, a human being on a human journey. Sometimes it's not just our identities that we get attached to. We might get attached to a belief or a belief system, an idea that can really hinder our capacity to come to face with that powerlessness. And one belief that I think nearly all of us hold, and probably few are willing to admit, is the idea that the world, the universe, life is a just and fair place. The pain of letting that one go, or at least owning the possibility that maybe it is just and fair, but I'm not equipped to see how true that is. Heidi came into the clinic. She was 32, newly diagnosed with metastatic colon cancer. She was desperate for someone to talk to help her make sense of this. She used that expression several times. Michael, I don't understand why this is happening. She had grown up in this Protestant tradition, but had found a lot of inspiration recently reading some Buddhist literature. But she said, I don't understand. I'm a good person. I'm not an angry person. I always help others. I've lived a good life. I would never knowingly hurt anybody. I volunteered all my life since I was a little girl. That's just the way I was raised. And I've always believed in God, but where's God now? Why aren't my prayers answered? Anybody recognize themselves in those questions? She raises so many themes there, not only this desire to make sense of it, as if one could, but what about understanding God or prayer or what to do with all of this anger? In some of my reading over the years, James Hillman, Gene Houston, some other folks, they talk about transformation. And that for any real transformation to occur, it must be preceded by a betrayal and a death. Not necessarily a physical death, but maybe the death of an idea, a belief system, a relationship, a job. Betrayal, death, transformation. That theme exists in Greek mythology when we kind of unpack some of those stories. It exists in the Jesus story, that Jesus had to be betrayed, had to die, in order for the centerpiece of Christian faith to take place, the resurrection, the transformation. Betrayal, death, transformation. It might be interesting to look back at your own life at certain moments of maybe quantum growth. Was it preceded at all in any way that could have been a betrayal and a death? With Heidi, we looked at what did she really believe and what was it saying about her view about God. And she had to admit she really believed if I'm a good person and do the right thing and keep my head down, I won't get sick and I won't die. And that whole idea had to be betrayed and had to die in order for a new understanding of who or what God is to be born to see her through the rest of her journey. It was as if, in her mind, God were really kind of the same thing as Santa Claus. It was almost interchangeable. If I'm a good person, and I'm a really good little boy or girl, and I eat my vegetables and I don't sass back, I'm going to get a shiny new red bicycle for Christmas. In a way, at 32, she had to grieve the death of Santa. Angela, in a similar way, came to her cancer, but from a different pathway, kind of through the pathway of Buddhism and kind of New Age thought. And she admitted, you know what, I thought if I was really religious in my meditation practice, if I really stayed positive, I could beat this. And I saw that I wasn't really meditating for what it could give me in that moment. I was meditating for this goal. Both Angela and Heidi got tripped up by another kind of an attachment to outcomes, namely cure. Nothing else would do. It would have to be the most human of all urges. Somebody with a cancer diagnosis, of course I want to be cured. But what if it's just not in the cards? What if the most I can hope for is a life with chronic cancer? Does that mean I'm not entitled to some experience of well-being and peace of mind and heart, of healing that might not include cure? Is it possible to be healed? Are healing and cure the same thing? Ben was this lovely older man, end-stage liver cancer, not much time left, and he knew it. To top it off, his wife had stage 4 breast cancer. When I went in to introduce myself to him, he invites me to come in and sit down with this demeanor as if it's cocktail time. So I come in and sit down and say, so what's going on, Ben? And he said, Michael, it's the best time of my life. I guess that makes me sound crazy, huh? Not at all. I said, tell me more. He said, well, it's like the first time in my life I understand my role in life. I feel comfortable in my own skin, and I get it. And it's enough. Yeah, I'd like to see Yellowstone one more time, but it's enough. Personally, I don't know that there's much more to aspire to in life than that experience of enoughness. That this job, this relationship, this life, this year, this day, this moment, this breath, it's enough. Talk about riding the wave gracefully. It's not at all uncommon for me to hear patients say, this cancer has been a blessing to me. Sometimes it comes out of their mouth and they're sort of surprised, or it feels like some kind of heresy, or it can feel kind of liberating. Jill was this tough gal in her mid-30s, a professional woman, very likable, but steeped in these values of self-reliance and independence. It was generational for her. You just don't ask for help, you do it yourself. She was a businesswoman. So she was so steeped in this tradition that when she was diagnosed with cancer, she had considered at first, I don't think I'm going to get treatment. I just can't be a cancer patient. I can't have people feeling sorry for me and wanting to help me. And then she moved from there to getting treatment, said, but if I get treatment, nobody's going to know I'm getting treatment. I can't be asking for help. I can't be the object of pity. I just can't do it. Over time, she has now seen this cancer as a sort of wake-up call out of that stubbornness. And she shared the experience of this relationship at work with her boss that has been utterly transformed. That she understands love in a whole other way, that it's not just giving it out, that it's also taking it in, that it's circular. It was really quite moving. As we're talking, she had this revelatory moment. She said, you know what, I think I'm glad I got cancer. And she kind of grimaced and couldn't believe she said that. And then she said it again, yep, I'm glad I got cancer. Talk about betrayal, death, transformation. Paradoxically, it takes a lot of strength to be vulnerable. Jill, like so many patients, like all of us really, I think, are so proud of our independence and self-reliance. And these patients share with me what a struggle it is to need the help that cancer demands. Needing it is one thing, accepting it is another. And yet I hear countless times as patients move from that place of self-reliance to asking for help and needing help, they share these amazing stories of this outpouring of love, often from the unlikeliest of sources. The friends who showed up, the friends who didn't, it's always a surprise. The thing is, it's a healing kind of love that restores one to interdependence and a sense of community. I'd call that a kind of magic. Louise is this powerhouse gal, a museum director, a kind of go-to person if you want to get something done. And she told me this amazing thing that happened to her at work when she came out as a cancer patient and acknowledged, I'm going to have to pull back some. The craziest thing, Michael, people started coming to me with their problems. And these are problems that pale in comparison to cancer. And they're telling me their problems. I'm the one with cancer, and they're coming to me. But the thing is, it was a blessing to me. Cancer had robbed me of so much, disempowered me, and here I was given the opportunity to connect and be of service in a whole other way. Sometimes it's not just being an attachment to an identity, to a belief, to an outcome, but it can be an attachment to a meaning that we've already made. We hold it too tight, we don't allow it to breathe and maybe shift and change it, or we confuse the thing with its meaning. We confuse the cancer with its meaning. We can confuse an object with its meaning. Lourdes was razor thin, wheelchair bound, rectal cancer, in her 70s, tenderly cared for by her son, Enrique. But on this particular day in the infusion clinic, she was pretty darn distressed, very tearful. She told me the story of how decades earlier she left her native Puerto Rico. Her mother gave her a few precious pieces of jewelry to remember her by. Now, Lourdes was also a bit of a pack rat, and she kept all of her belongings in little bags and baggies strewn on the floor surrounding this recliner where she spent all of her waking hours. Earlier that week, in an attempt to tidy up, Enrique inadvertently threw out the baggie with the jewelry in it. She was beside herself with anger and with grief. She said, Michael, I haven't been able to sleep all week. I haven't been able to eat. I lost 6 pounds. If you saw her, you'd see she didn't have 6 pounds to lose. And I'm so angry at Enrique. Why is he such a control freak? How could he be so careless? I invited her to gently dip into the spiritual waters of forgiveness, which was not a good call on my part, I admit. So then I invited a reflection on what was the real gift her mother gave her. Was it really jewelry, or was it her undying love and affection? And that's a gift you can't lose, you can't throw it away. In a similar kind of way, it seemed Lourdes had the gift of precious little time left on the planet. Is she going to spend the gift of that time enjoying the love of her son Enrique, or is she going to spend it stewing in her own anger? She just might. I sometimes think the last power we have is the power to assign meaning to our stories. All of us here, I'm sure, have people in our lives who, with the best of intentions, want to tell us what meaning we should make of our lives and what books we need to read and what clinic we need to go to and what supplements we need to take, and will you just listen to this guy in his lecture? And it kind of negates our own hard-won journey toward what treatment we are going to take and what meaning we have found here. And a part of us might hunger for that affirmation and approval outside of ourselves, but we might just want somebody to just get it and be with us. But in doing so, sometimes we give away our power. Can we be at peace with our own hard-won decisions as solitary as they may be? Can we come to some kind of peace with the seemingly never-ending pattern of betrayal, death, and transformation that is life? My father died New Year's Eve, 2004. There aren't too many relationships that would seem to have more inherent meaning than a son and a father, a mother and son, mother and daughter. It's ancient, it's primal, it's organic. We had an uneasy relationship at best, but I find even though he's been dead for 10 years, the meaning of that relationship continues to unfold. 7 years before he died, my sister Terry and I interviewed him on videotape about his life rather exhaustively. Even so, it's still just a snapshot. It's not the whole picture. As I mentioned earlier when I began, he flew B-17s over Germany during World War II. And he was telling us about a ritual he had with his crew before they would take off for every mission, checking out the intercom system. My dad, as the pilot, would begin singing into his headset, "I've flown around the world in a plane." Bombardier comes on, "I've settled revolutions in Spain." Tail gunner comes on, "The North Pole I have charted, but I can't get started with you." A popular song at the time. I thought that story was so sweet and small and specific, and it brought this whole youthful and human dimension to a man and to an experience that was just outside of my comprehension. Many years after the war, my dad called his co-pilot, Milton Tarr, out of the clear blue. Milton answers the phone and my dad just sang, "I've flown around the world in a plane." Milton just barked, "Who the hell is this?" "It's me, Albert. Remember how we used to sing before we take off on a mission?" Milton had no recollection, which made my dad sigh, just like you did, just like we did, to hear that story. And that story's 17 years old, and as you can see, it still chokes me up, and I don't know why exactly. But maybe it was a glimpse, a rare glimpse of my dad we didn't get to see too often. I don't think he was ever really at ease with being a dad, and certainly not one with 2 gay kids. The times we could ever meet and be on the same page about anything was pretty rare. But it has meaning to me. And I will take it. And I still love the idea of the Gothic heart, even if there's no such thing at all. May we all ride our waves with grace and ease, with more fascination than fear, keeping our eyes open for blessings that we don't know we're looking for. May we take comfort in the meaning we have made from our own lives, and may we not hold it so tightly that we can allow it to shift and move and change, or maybe even lose meaning altogether. It is ours. That's what I've got to say. So with the time we've got left, I'd love to hear any questions. Thank you for listening. Yes, sir.
Keeping it positive is
Yeah.
very important, don't you think? I mean, going through life, just staying positive, even though you brought up the idea. Let's look at this in reality. Let's look at these other things, what this really means. But I guess being an optimist is more important to me, I guess. Just staying positive. Isn't that a good thing to always stay positive, not be so real? I don't know. Maybe I'm not saying it.
No, you're saying it, and I understand. And there's a whole lot of, not inspiration, kind of almost demand in the culture for that point of view. Like, you got to stay positive. Everybody knows positive attitude's everything. Some of my patients call it the tyranny of positive thinking. The most operative 2 words you said to me were, "to me." It's meaningful to me to be positive. It's not meaningful to everyone. For me, I'm a chaplain. I tend to look at things through a spiritual lens. A more important value than demanding somebody be positive is grace. which means to me allowing them to be exactly where they are and accepting them with no need to change it. To me, that's a place. I find that tyranny of positive thinking, I see patients cause themselves suffering. I'm so depressed, I know I got to be positive or I'm never going to get better. Bam, bam, bam. Beating themselves up every step of the way. Can't it be okay to just be down for a day? It's like, to me, it's like a kinked garden hose. You can say, nope, you got to be positive, and that water is going to squeak, squeak, squeak through. We can't hold on to a feeling for 5 minutes even if we want to. You go see a movie that just makes your heart sing, and you come out of the theater, you go, oh, God, wasn't that great? And soon as somebody cuts you off, damn, I'm back right where I was. We can't, every feeling you can guarantee is going to change. It's like water going through a hose. I like the image of just unkink the hose. Just let it go. Oh, there's a depressing thought. Okay. Ooh, it's pretty angry about that. Oh, it's a sweet thought. Isn't that nice? There it goes. You know, and I can be at ease in a different way than I got to be positive. I got to be positive. And it might work for some people to just, I'm going to do my affirmations. I'm not going to let in any negative thoughts. For me, my interest and what I see that point of view can also cause suffering. Any other thoughts about that? Agree, disagree? Yes, sir.
A recent article said that pessimists actually live longer.
Okay,
More realistic.
that could be.
True.
It's how you live in that time that you have.
Oh, I couldn't, yeah, okay, here you are. So tell me more what you mean by that.
Well, you know, you're gonna give me 2 years, you give me 1 year. 1 good year, 2 bad years, how I feel up here, not just how I feel inside
Yeah.
my body. It's my mind, my soul.
Right.
If I have that, that's what I'm looking for. Grace we're talking about?
Right.
That's a big part of the journey.
And that's for you.
Yes.
I had a patient recently, and even all the doctors were kind of stunned. My God, this man went through torture. But he said all along, I'm all about quantity, not quality. As long as you can keep me alive, keep me alive. I'm going to take every drug you got, just hit me. I mean, you know, he was just this wreck of a guy because he did not want to leave his wife. And most people would tend to say, you know what, quality up to a time, I don't want to go there if it's just going to be on hoses and pumps and unconscious. But he was of a different, so for him, wasn't about that. Once I remember working on the inpatient side, I went into a room in the stem cell transplant unit. The husband was the patient and the wife, they just two different dynamics. They had been in the hospital forever and came in and how you doing today? And the wife says, oh, great, we're going home next Wednesday. And he's, no. You have to be positive, you have to say that. His game plan is, I want to avoid disappointment. He hates disappointment more than anything. Don't tell me I'm going home Wednesday and then Tuesday night say, nope, it's another week. So he doesn't want to attach to that. And she's saying, tell him, Chaplain, tell him this is right, you got to be positive. I'm not going to tell him that. Everybody's got their own way to walk the trail. Some people need to sit down and look at the scenery, and some people need to, got to get going, got to go. It's just a different way of doing it. And my interest is in offering people grace to do it their own way. And if I see them causing themselves suffering, where can we kind of get in there and loosen that up a little bit? How can we? I don't like to see somebody beat themselves up and call it a pity party when they just had a really depressing day. If I was throwing up all day and couldn't get out of bed, yeah, I'd be upset and pissed off too. Who's going to want to go do a cheerleading thing after that? Other thoughts, reflections? Yes, back there.
What kind of advice would you give to someone who, if they're having a not positive day, it's freaking out everybody around them? I tend to be a positive person. I'll have
Okay.
been, but when I have a bad day, I feel like I still have to
Oh, yes.
fight through it for everybody else.
It might be, I'm not in your shoes, and you know way more about how to do this than I do. My sense is a few things. You can kind of disappear and say, just don't talk to me. It's like some people cope with depression by just seeing, I'm going to bed, I'm not answering the phone, don't talk to me, and somebody just give them the space. If they freak out, I've had patients say, you know what, I can't take care of you anymore. I know it's making you freak out, But this is me now, I'm sorry, you're on your own. I can't, and when sometimes people hear it that you're spending more energy taking care of their fear about you, sometimes people back off. But ultimately, it's your own integrity that you have to honor, that if I'm down and I need to do this today, if I need to not answer the phone, I'm going to do it. And other people are going to have to get over it. Rather than run yourself ragged to keep up the facade for everybody else to be at ease. It might mean a one-on-one conversation. It might mean a family meeting. I got to sit down. I know you guys love me. I know you're scared. I'm scared too. But we're going through this together, and when I'm having a down day, I can't have you flipping out. I just don't have the energy for it. I don't know. What do you think about any of that?
Well, it's like it starts a downward spiral. So if I'm down, they get free, they get down, which brings me further down, which
Yes.
brings them further down. So I just feel like it's just better if I just stay up and.
Then if you found a way to make it work, then that's the way to make it work.
But then that's not really honoring.
If you're managing, and everything's a cost-benefit analysis. You've just kind of said it's not worth it to bring them down because then I'm even taking care of them even more and they're down and it's this hole. So I'm going to, but to me just being conscious about it, I'm doing this for today or not, that there's limitations, there's boundaries on it. It sounds like you found a way to negotiate it. And again, getting back to a spiritual premise for me, to me, life is about intimacy, and that we all came here to be more intimate, not less. And so my faith tells me to go in the direction of intimacy, even if it causes more suffering. Because they'll be free, maybe, to then tell their truth, and then we'll be able to have this conversation. And even though it's about dark stuff, the fact that I'm connected to you, I'm actually kind of floating higher, because now I know I'm not alone and I'm being absolutely real. Do you know what I mean? It's just a thought. Yes, sir?
She kind of brought something up there, and I think she might be talking about the caretakers.
Yeah.
Any words of advice for, because you've been talking a lot about the
Right.
patient. What about the caretakers? You know, we're on this journey.
You bet. Cancer affects the whole family. And I would say almost everything I said is for the caretakers too. The honoring your own limitations, honoring that you're suffering too. Yes, if I'm the husband or the loved one and I don't want to complain to her that this is really hard to take care of you, I'm going to find somebody to tell that to, you know, and then I'm going to be taking care of myself. There's a wonderful article in the LA Times last year, and I've seen it kind of floating around Facebook again, that kind of explained this. Now I said I don't want any audio visual now if I only had a flip chart. But it's like concentric circles of suffering. The one who is at the center of the suffering at the crisis in the center of the circle. And then there's rings kind of intimacy. Then there's the spouse in the second circle. There's the rest of the kids, the family. Then there's the really close friends. Then there's the email list. There's everybody out. So the person in the center gets to say anything to anybody. The next ring, you only get to support the person on the inside. All of your complaints go outside into your ring or further out. You don't take your dumping to an inner circle. And it's a great image. Does everybody kind of understand the image? Yeah. So if I'm the friend and you're the one with cancer, I don't say, oh yeah, my mom just got cancer too. She's really sick. Let me tell you about that. And somebody rear-ended me today. And people do that. You know, take your rear-ending story to the next outer circle. And that's a great thing for caregivers too, because the caregiver is the next circle. You know, share in your circle or go out. Find a therapist. There's plenty of support groups out there for caregivers. And absolutely, and men in this culture, stereotypically, are raised to be able to fix things and do things. And cancer hits you right where you live, because often you can't do squat about it. And go on a cancer floor at UCLA, and it's often you see the husbands walking the halls or down in the coffee shop, and it's the mothers and the wives who are keeping the vigil by the bed, because they can just be present. It just hits the men so hard, there's nothing I can do in there. I can't breathe in that room. Honor yourself for that. Okay, it's the way I was raised, I can't do it. But the one thing I can do, to change my lens. Just sitting here and listening to you is doing something. It's doing something profound. Just to try listening everything that person says with no suggestions, no advice whatsoever. Oh, honey, I didn't know you felt that way. Tell me more. Tell me more, the 3 most magic words you can say to anybody when you're supporting them. Tell me more. No need to fix it, advise it, change it. And that is a profound gift. It feels like nothing, and it's the most enormous gift you can give somebody. That's all I do. People say, what do you tell patients? I don't say so much. I listen a lot. Other thoughts, reflections? Yes?
When I was going through chemotherapy, I was the type of person who felt privileged to experience that. I had very good feelings.
Why?
I look forward to going to chemo, and I made friends there, and I had so much support from people from all over the place. I felt like a lot of personal growth. I mean, I almost felt lucky to
Wow.
experience this.
Did that surprise you that you felt that way?
It did, because when I learned my diagnosis, I cried that day, and then I said, I'm not going to cry again. And I'm going to move on. It's another thing I will work on in my life.
It
And I
sounds-
was really happy to be out of work. I never realized.
Wow.
My-
A vacation is nicer than chemotherapy.
I was in the hospital 7 days, and I realized how tired I was from the kids, the work, and I just felt in peace throughout the chemo.
That is so moving.
Then afterwards, it hit me, and my doctor said it's like post-traumatic stress.
Yes.
And now I'm going through radiation. I don't feel as strong. That's why I started coming here.
Okay.
But I sailed through the chemo with very good feelings. So many people, colleagues, neighbors. I have religious neighbors. They stopped me during my walk and hold my hand and pray for me. Very meaningful. Came out of this, you know. So in a way, I felt lucky to stop and enjoy these.
Thank you for sharing that. It's very beautiful. That's a graceful riding of the wave in my book.
Is it?
Yeah. Anybody else? Yes.
Could you repeat what she had?
Oh, I'm sorry. She was sharing that she was kind of surprised that she felt going to chemotherapy was a blessing. She didn't realize how unhappy she had been at work, and cancer was kind of a nice break. She met a lot of beautiful people there, and she's surprised that it actually was kind of a blessing. And now some of that's wearing off. Going through radiation isn't such a day at the beach. But she's still working in that, on that mindset. Is that accurate?
Yes.
Okay. Any last thoughts? How are we doing on time? Yeah. 10 more minutes? Anybody want to say something you're afraid to say? Yeah.
Well, just, it's so rich what you've shared. I'll probably have a lot of questions tomorrow.
Okay. Well, I've got business cards there. You can email me.
But I guess I was thinking about how we move forward, and how do we integrate it? Like, how do we? Does it take a year? Does it take 5 years? In other words, how long do you find people working on kind of making sense of it inside themselves and making meaning of it and this kind of thing?
Boy, does everybody hear the question?
I can't repeat it.
Yeah. It's a big question, and I hear the desire and the answer for kind of, am I doing this right? Am I on schedule? Does it make sense? As if there is such a thing. I'm supporting a couple people individually through bereavement right now, and I find it very common that, shouldn't I be feeling this by now? And I've got a cancer patient who's an oncology nurse herself, and I know by now I should be feeling this and I should be feeling that, and I'm not. And it's like, what if there's no book? And if anything, I'm trying to share that meaning making goes on your whole life. I thought I understood what my dad was about, my relationship, and it's still going. My grandparents, who I was at 30 that felt so true and now doesn't feel true. For my spiritual journey, I want to come to peace with the process, that I'm never going to be certain, I'm never going to know. I'm going to think I've got the truth, and then it just evaporated. And instead of saying, shouldn't I be here by now, and how long is it going to take before I'm happy or fine, this is it, right now, this moment, this breath. This is as happy as I'm ever going to be, it's as sad as I'm ever going to be. And then I just stay in it, stay in it. And I wanted to be, I was a good student too, so I want to get the A, I want to be on schedule, I want to be ahead of schedule. What can I do for extra credit to get ahead in the spiritual test, to get all spiritually competitive, you know? And to me, the answer is in the question. Give up the need to judge it or compare it. I'm just exactly where I am, and this is how it is right now. And we'll see what tomorrow brings. This moment is all that we have. And boy, we don't like to think that. We want to plan, and no, I want to control this into the future, and I'm out of control. But we have this illusion that we're in control. I'm very blessed. I love, love, love to travel. And I just got back from a trip to India that I'm still digesting. But the out-of-controlness of life is everywhere. There's no escaping it. And as hard as it might be on your senses and your heart, it feels kind of liberating, because like, this is true. We live in environments here in this culture where we try to hide all that. Oh, we don't want any big signs in Thousand Oaks. So you go down to Irvine and everything is so perfect and neat. And it's like, no, there's no mess here. India, there's no such thing as no mess. There's mess everywhere. And life is messy. But we want to pretend that we can control it, we can make it tidy, nobody's going to see our garbage. And for me, again, it becomes a spiritual question. I would just want to acknowledge we are all suffering all the time. And we always have the opportunity to connect with it, and there's joy in that. I'm going to be open to finding joy in unlikely places. Sometimes we can have the biggest belly laughs in my circle of reflection group with people who are facing the end of their lives. But the joke is so good. It's like, now I get it. You know, I never was in control at all. So I don't know if that's an answer to your question, but any last thoughts? Yeah.
In response to her thing, I've been dealing with stage 4 for a long time. So to me, I just think of it as constantly dealing with my new normal. This comes up, this is my new normal. So I'm never achieving that old normal. I'm just working with the daily things that come up, and this is my new normal. And how can I embrace it, and how can I deal with it, and keep moving on?
I think that's great. I think that's great. We are all going to lose everything we love. And that's still news. It's news to me. You know, we're going to lose our bodies, we're going to lose all our relationships, because everybody's going to die. And so when are we going to come to peace with that and pretend that's not happening and embrace this moment right now? I mean, that's my spiritual practice. How can we do that? And that's my new normal is, I can't, you know, I just turned 60 and I love to dance and I've got arthritis in my feet. And Ashara, bless her heart, when I began as an intern, I just got to tell this story. 15 years ago, she was a social worker, and she came and gave us a didactic on growing old and to give us compassion about how we're going to embrace our aging. And she made us put unpopped popcorn kernels on our shoes and walk around and, ooh, ouch, ooh, now I've got popcorn in my shoes without popcorn in my shoes. So that's my new normal. I can bemoan, ooh, well, when am I going to get back to the way it was? It's not going to, you know, we got to accommodate the new normal. Any last thoughts? Yes?
So what would you say to a person who is experiencing physical pain and constant, almost intolerable pain, and he would consider giving up his life, but he wants to continue living for his family, but physical pain?
Yes, I see those patients, and I don't think there's anything more soul-crushing than physical pain. Except maybe soul pain. When I worked in the psychiatric hospital, soul pain, when there's no physical symptoms, but that's almost worse because nobody can see it, not to compare suffering. But with somebody's pain, you can't tell them anything. You can be there. And that's hard, especially if you love the person. I don't know what to say. There's nothing I can do, but I'm not leaving, and I'm here. And whatever you want, you know, if you don't want to fight anymore, don't fight. It has to be okay with me. And I don't mean that to sound like I've got a tidy answer. There isn't a tidy answer. It is just, I'm sure there's plenty of folks in this room that have loved ones who have been in that situation. There's nothing you can do, and there's no medicine that can alleviate the pain. But you can show up. I wish I had a more magic wand than that. And that's not a small thing. I began what planted my seed toward chaplaincy was I did volunteer AIDS hospice work in the peak years of the crisis, and the nurse who was teaching us kind of what to do, and they were just sending us out with very little training to people who were dying of AIDS. I mean, it was just everywhere. But she said something that stuck with me. She said, you're going to put your foot in your mouth all the time, and you're going to say the wrong thing, and you're going to unwittingly hurt somebody's feelings, but you showed up. And it has to be enough for now. And just to go in, I don't have the perfect thing to say. I hear sometimes friends say, my friend's dying of cancer, but I can't go see her because I don't know what to say to her, and I get scared and everything. Go in and say, I don't know what to say, I'm scared. And I'm here. Period. Yeah, there is no perfect thing to say, somebody suffering like that. Thank you so much for the opportunity. I have this poem that's a nice way to go home. It's called Blessing the Boats by Lucille Clifton. May the tide that is entering even now, the lip of your understanding, carry you out beyond the face of fear. May you kiss the wind and turn from it, certain that it will love your back. May you open your eyes to water, water, waving forever. And may you, in your innocence, sail through this to that. So be it.